Okay, welcome to the questions and responses, the Q&R for the lung series. Question 1 and 2 are very similar. Okay, one from Imran Komi. How can we restore lung capacity to CPOD? I think you meant COPD, and the second one is asthma and COPD reversible. Absolutely, yes, it is. But you do not reverse it by suppressing symptoms. This is why when you see like Tylenol, asthma medications such as sympathetic stimulants or steroids, all of these things have a negative effect on how the body regenerates itself. So if you're looking at this, there's three things you got to address. One, the nerve supply. Okay, that means to the diaphragm and the phrenic nerve comes out of the neck. But also you're looking at an inflammatory process. And inflammation, such as bronchitis, okay, that means that the bronchus, the air tubes, are inflamed. So look at gut health. That's going to be one of the keys as well, because it's literally the tissue production. And you can have an overproduction of inflammatory aspects of that lung from particulate matter coming in, from the excess mucus production, which is super, super common, and particularly in asthma. And so it's immune system and tissue production issues. So three things you got to address: physical, chemical, and emotional stress. Physical stress, you look at the connection where the diaphragm is. So you're looking at the thoracolumbar junction. Got to get an x-ray of that area, x-ray of the neck area, and the cardiac and respiratory center is located at the base of the neck. So here, the phrenic nerve, C3, C4, C5, and the insertion of the diaphragm. Make sure that's clear. Hydration, hugely important. Okay, make sure that you're getting healthy water, and I'm talking spring water. You're going to add a little bit of minerals in it. Look at sleep patterns, because this is when the body regenerates. Look at nasal, diaphragmatic breathing. Multiple studies on nasal diaphragmatic breathing helping COPD. Why? Because you're utilizing the bottom 2/3 of that lung. Typically, if you're only chest breathing, okay, you're using the top third of the lungs, which is the least surface area. So hydration, nerve supply, then look at the gut function. Okay, if you're getting 2 to 3 healthy bowel movements a day, you have good tissue production. Look at juicing and blending to help you. If your blood is thick, okay, and that's from increased blood viscosity, could be from certain stress factors. So if the blood is thick, it's going to increase pulmonary hypertension and also increase or decrease that carbon dioxide oxygen transfer. And it's going to make you feel like you're drowning. So healthy blood is going to be the key. And you need healthy stomach acid in order to create that electronegative charge of the red blood cells, so they repel each other, so they're not stacking on top of one another. Look at collagen supplements or bone broth. All of this, vitamin C is going to be helpful. So all the vitamins, nutrients, minerals, gut health, getting the blood healthy, nasal diaphragmatic breathing is going to help, and the restoring the nerve supply. Then look at sleep patterns as well. Sleep is when the body regenerates. So all of these factors, look at lung issues, and I'm talking COPD and asthma, has an alarm system of the lungs, not a problem of the lungs. And you're going to notice differences immediately. Just simply has hydration. Cayenne supplements is going to help thin the blood and vasodilate, and diaphragmatic breathing. Those three simple things are going to make a difference right away. But make sure you're getting heat as well, because if you have inflammation of the bronchus, if you put more heat on there, that's going to rush more blood to the area. Look at inflammation as a healing aspect of the lungs. That's why the things that decrease inflammation is not good. Question 2 from Vili Heislip. Tell me about pulmonary arterial hypertension in a 6-year-old. How? Let's look at the stressors. Now, a lot of our kids are exposed to a huge amount of Th2 or inflammatory responses from certain interventions, as well as toxic diet, toxic food. Past antibiotic use can create an increased intestinal permeability, which causes proteins that aren't tempered by digestion floating around in the bloodstream. And then this triggers a hypersensitive immune system response. It's also poor diet, dehydration, the intestinal issues. and certain medical interventions that trigger an inflammatory or Th2 response. All of these are equating to a higher level of blood issues, cardiac issues, and breathing issues, okay, in a child. So let's build the kid healthy. Don't do any interventions that trigger inflammatory responses. And look at things that damage the tissue, such as acetaminophen or Tylenol, okay, and that's the main ingredient. This depletes glutathione, and this is how the liver and brain protect itself. So look at juicing, blending, look at moist heat on the tummy, because the tummy is where most of the immune system is. Look at increasing the hydration level. Okay, look at things that toxify the blood, such as poisonous oils like corn oil, canola oil, soy oils, all the manufactured oils, the clear oils, those are toxic for the kid. Look at pasteurized dairy. Again, those are create inflammation, create mucus, and that's going to increase the pressure of that heart that has to get that thick blood that's not good and healthy to those lungs. So doing a live blood cell analysis will tell you the health of that blood very, very quickly. If the child has poor sleep patterns, if the child has had antibiotics in the past or commercially produced food, that's going to weaken the gut flora and weaken his tissue production. So look at pulmonary hypertension or pulmonary arterial hypertension has a body that's responding correctly based on the stress. The kid's going to have a poor gut function, going to have poor sleep patterns, possibly dark circles under the eyes because of the low stomach acid. They're going to have literally poor tissue production because if a person has healthy amounts of stomach acid, then the red blood cells are separate and they can hold more oxygen than the blood pressure that pulmonary hypertension are getting blood supply to the lungs. It's going to be in a normal state. So it's an unhealthy blood, unhealthy tissue production, and inflammatory processes going on in the body. So fix the physical, chemical, emotional stress. Watch the medications that they have. Start putting moist heat on the chest, moist heat on the gut. Get the kid up to 2 to 3 healthy bowel movements a day. Make sure the kid's sleeping good, and make sure the kid eats healthy, organic vegetables. Okay, because it's easier to get the amino acids from there. If you're not vegetarians, bone broth, chicken broth, literally hot liquids will help as well. Look at breathing in antimicrobial herbs such as eucalyptus oil or oregano leaves. I would put oregano leaves in my kit or in a big pot and boil it and have them breathe in the steam. Okay, take it off of the stove so it's not too hot. And that I would do that for lung issues, sinus issues. And you're going to see as mucus production go down, the blood gets healthier, and that pulmonary hypertension will start to change. But also watch those medical interventions that trigger inflammatory processes. Question 3 from Longoule Duret. Can intravenous high-dose vitamin C benefit the lungs? And so many questions are how hard are hyperbaric chambers to find for the health of everyday citizens? Yeah, okay, let's look at vitamin C. Absolutely, it's an antioxidant. All antioxidants are going to benefit not just lung function, but how your body regenerates. You figure you go through 1 billion cells a day, break down and build up, and that's called an oxidative metabolic process. And inflammation actually is a healing process of the body. So when you have inflammation, that can create free radicals. Antioxidants, such as found in every fruit and vegetable, and vitamin C is a powerful antioxidant. It's also, reacts as a stress hormone. You're also looking at any fruit and vegetable has phytonutrients, omega-3s are antioxidants. Okay, antioxidants deactivate the free radicals of that inflammation process and allow inflammation to work, where the non-steroidal anti-inflammatories actually damage the tissue. Look up Linus Pauling's work. Okay, they have a lot of data on vitamin C, immune system, and lung function. Very, very good. But there are subtherapeutic doses that are recommended by certain healthcare professionals that don't understand it. And then there are therapeutic doses where you take enough vitamin C to get diarrhea, and that's called bowel tolerance. And make sure it's whole food vitamin C. I mean, there's a lot of good forms out there, but it is one of the greatest nutrients out there, but it's not the only antioxidant. And hyperbaric chambers, they are hard to find. But if you can't find them for regular citizens, I mean, like if it's hard to find or expensive, practice diaphragmatic breathing, because hyperbaric just puts your body under pressure and you're breathing in pure oxygen. So it increases the oxygen saturation of the blood. Now, we have our own hyperbaric chamber at our clinic in Mexico, and this is really cool. We're building a secondary chamber that gets on there so we can do intravenous therapies while you're in the hyperbaric chamber. It's not ready yet, but it's going to be ready soon. And so that's going to be ideal. But if you don't have access to it, diaphragmatic breathe. Put your hands on your tummy, push your tummy in and blow out, then breathe in through the nose and fill the tummy up with air. Practice that diaphragmatic breathing, and you're going to be using the bottom 2/3 of your lungs. We can call that poor man's hyperbaric chamber, because it is going to increase the oxygen carrying capability of your blood. You're going to saturate the blood with oxygen. It's similar to what you would do in the pure oxygen state. Although the pure oxygen, those hyperbaric chambers, man, do we get utilized. And we even do before and after blood analysis, live blood cell, and you'll see a difference. Absolutely wonderful. Question 4 from Mike Hammond 007. Is there anything you can do for systemic scleroderma with interstitial lung disease? Interstitial lung disease, and ever reverse it? Yes, there is. My sister-in-law has it, and I don't know if she's receiving the best of care for it, even though she is supposedly seeing some of the best specialists in Tampa about it. Yeah, when you're looking at systemic scleroderma with lung issues, okay, scleroderma is a tissue production problem. Now, the tough part about lung experts, or the best of the specialists, if you're looking at a lung issue and a tissue production issue, they don't look at it like that. They look at it like a disease. So they try different medications to control that disease process, even though a lot of the disease process is actually the body healing itself. So what you got to do is look at the 3 different stressors: physical, chemical, and emotional stressors. Now, I've had scleroderma patients from all over the place. And when you see it in severe stages, you're talking the entire skin gets tight and they can't even move it. Well, what is that? That's a collagen issue. Now, you break down proteins to amino acids, and the amino acids, that's what you use as building products. So ultimately, it's a tissue production problem. So your sister-in-law is going to have poor gut function that has to be addressed. So, and she's going to be in a sympathetic dominant state. For one, she's in a hypoxic state. Now, there's certain conditions that low oxygen levels are helped. There's a lot of conditions that low oxygen levels are not helpful. But this, she's going to have poor blood health. And your blood can change its viscosity based on stress levels, physical, chemical, or emotional stress. So we've got to get the blood healthy, the gut healthy, sleep patterns got to be changed, and tissue production's got to be changed. So it's literally physical, chemical, emotional stress. Physical stress, you've got to look at any physical stressors, because if she has compromised problem in the neck, old neck injury, old thoracic injury, that's going to prevent the oxygen carbon dioxide transfer, can alter nerve supply to the diaphragm, can put that person in a sympathetic dominant state, which means that they can't have healthy digestion or healthy breakdown of the amino acids to proteins, and the fatty acids to healthy fats. So there's going to be a tissue production problem. Look at altered gut function. Sympathetic dominant states usually mean that there's decreased blood supply to the gut, and that's not only immune system, but tissue production. Then you got to look at the gut function. So healthy gut bacteria is going to help. So the physical stressors, got to get to a corrective chiropractor, get that assessed and corrected. Heal the gut. That's going to be juicing, blending, collagen supplements. Look at bone broth production. So you're getting that collagen in the system, so your body can start to build it healthy. get movement and create inflammation at the joints and at the tissue so the body can start to regenerate. And look at the things that damage the tissue. And this is probably prescribed by the specialist. Acetaminophen is going to damage glutathione, and that's going to damage the brain issue or damage brain function, putting the body into further stress. All steroids weaken the body's ability to heal, and it makes your body feel good temporarily. But remember, scleroderma and this problem with lung function, these are alarms for tissue production. So if you're not addressing the overall tissue production of the body, the patient is not going to get better. And this is where a lot of specialists missed it, because if she's going to a lung issue or a specialist or a dermatologist specialist, and they're missing that it's a gut function or a nervous system autonomic imbalance, or that there's a physical stressor that's being completely missed, or the blood, a live blood cell analysis is showing that the blood's not healthy, you got to look at every stressor. You look at the physical, chemical, emotional stress, and she's going to get healthy. From Larry B., are CPAP machines bad for your lungs? When you look at this, a CPAP machine is forcing air into the lungs. Now, this can temporarily help with certain conditions, such as oxygen transfer. No one's suffering from a lack of CPAP machine. Now, the CPAP machines can also increase pneumonia. It can increase problems with the lungs. It's difficult to treat or to clean, so there could be increased mold. There's a lot of problems with CPAP machines. And what do they say? Lose weight. Why would heavy-set people have sleeping issues? Well, because you have an oxygen, you've got heavy fat inside of the back of the soft palate, can start to close off the esophagus. There can be tissue or swelling there, which closes off the trachea. There could be a lot of issues. Well, fix the problem. No animal on the planet lays down and forgets to breathe. So you got three things you got to address: physical, chemical, and emotional stress. Look at the physical stressors for looking at the curve in the neck. That's the cardiac and respiratory center at the base of the brain. You got the nerve to the diaphragm, C3, C4, C5, and you got the attachment of the diaphragm at the thoracolumbar junction. Look at that for sure. Look at the health of the blood. If that blood is separate and healthy, beautiful. But look at digestive enzymes. That may help, because that's going to help break down the protein, fats, and carbohydrates. Look at juicing and blending, which is going to pre-digest the nutrients so your system can start to build itself healthy. And so far, 100% of people on CPAP machines that I've seen have been able to get off the CPAP machine. Why? Because no one's suffering from lack of CPAP. And that breathing issue is not some made up thing. These people are having an oxygen transfer issue. So fix the problem. Just find a doctor that understands to look for the problem. Question 6. This is from Debbie Harris, 4484. Doctor, could you please discuss particulate matter and how to protect clear silica or other small particles, specifically what to do when it's 2.5 parts per million, is 25 to 30 micrograms per centimeter cubed in a residential area. This is interesting because I figure I grew up in the 1970s. This is when we had leaded gas in the valley area, where they would shut down exercise programs in school, and you would walk home and your eyes would literally burn. The Hollywood Hills were only about 3 miles away, and you couldn't even see them. So I'm very familiar with growing up in a toxic environment. Now, if you look at the parts per million, it's different on where your location is. So like if you're located next to an industrial plant, such as a refinery, and where my boat is, it's close to a refinery, except I'm upwind from it. The people downwind from it are going to have a heck of a lot worse exposure than upwind. The inside air, if you have lung or air filtration, is going to be completely different than the outside air. So don't just look at the parts per million according to the air quality industry. It also has to do with wind, with transfer. If you're close to a bus station, if you're on the upwind side, and it's a potential exponentially different the distance away from that toxic producing environment. And this is buses, roadways. You see a lot of different studies on particulate matter. So, a lot of things that you can do. First, look at your own health. Look at gut health. This is where you produce the tissue. So, if you're up to 3 healthy bowel movements a day, fantastic. As weird as it sounds when we're talking particulate matter, look at probiotics and prebiotics and fermented foods to build your gut health. Look at healthy sleep patterns and get air filtrations in your room where you sleep. Okay, look at our sleep restriction videos so that you can reset your circadian rhythm so you can get deep sleep. So your sleep environment where you regenerate your tissue, keep that as clean as possible. And that, and particularly in industrial areas, you should be able to do with a very, very simple filtration system. And look at infrared filtration system, ultraviolet light filtration system. There's a lot of simple non-toxic ones that work. Look at essential oils to filter to help with the inside air. Then the outside air, because if you got healthy gut function, you're going to have healthy tissue production. Look at a lot of nasal breathing. It's really hard because those stupid masks that they were forcing people to wear to prevent a cold. Okay, those things don't really do anything unless it's really heavy particulate matter. And the negative is you're rebreathing in your own waste. So there's a lot of negatives to the simple masks. If you're working in an industrial area where you do have exposure, use the appropriate mask for it. But when you're away from that area, filtering the air coming in is also causing an increased carbon dioxide transfer in most of the masks. So you can't wear it 24/7. It's not good for you. But if you have healthy blood, your body and healthy mucous membranes and healthy lung function, you're going to be able to wall off that particulate matter and be able to adapt very, very well. This includes not just 2.5 parts per million. It includes a lot of different particulate matter. So distance yourself from the source, clean the environment that you have control of, and strengthen your immune system, and you'll be able to adapt as best as you can. And of course, if you're, next to some type of industrial pollutants, try and find a different place to live. But a lot of people in inner cities, in close to factories, they don't have that option. Question 7 from Hakeem Shan, 5968. Hi, doctor. I'm a 26-year-old male living in the United Kingdom. I'm a pretty fit guy, living with damp mold in my flat for 3 months. I've already had problems such as fatigue, breathing difficulties, weight imbalances. I do a lot of swimming, which has helped. Can my health fully recover even though I have fixed in a damp mold? Yes, you can. Bacteria eat mold. Bacteria eat mold. That's the key. So the more that you get healthy gut bacteria and healthy lung flora and healthy skin flora, this is also why when you're swimming, if it's in a chlorinated pool, that chlorine actually gets in the system and can decrease the mold. Then look at healthy minerals like chlorine dioxide is going to be fantastic. Just do a little bit of the chlorine dioxide. Andreas Klackner with a K has got a great site on how to make it. We make our own. That's going to help a lot. But look at probiotics, prebiotics, and fermented foods. Also, look at getting your physical, chemical, and emotional stress is going to be hugely important. Cleaning your flat, not with toxic chemicals such as bleach or ammonia, and never mix those two, by the way. Using vinegar, which is fantastic. I use this on my boat. White vinegar is amazing. Look at borax. Again, that's an amazing natural cleaning product that will actually kill the mold spores and not be toxic to your system. And you will get healthy.